not straight, and the food can easily get stuck into my teeth. So I think I need to get braces.
Okay, there's a few examinations for me to do before we actually get refer you to ortho opinion. But before that, do you have any medical problem? Any drug allergies? Okay, so in order for me to refer you for ortho treatment, there's a few requirements and a few examinations that will be done. If you actually pass all the requirements, then we will definitely refer you for your ortho opinion to the specialist here. Okay, so we'll start with an extraoral examination. I'll need you to sit up straight. Okay, chin down a bit, face forward, look in front. Alright, very good. Okay. So we'll check the lips now. Relax. Alright. So now we are done with the extraoral examination. We'll move forward to the intraoral where I will be checking inside your mouth, okay? Okay, so now I'll be doing an intraoral examination.
As we examine intraorally, we must check the oral hygiene, count the teeth present, take note if any permanent teeth has been extracted or not. And then, we move on to the diagnosis for the malocclusion and finally the IOTN scoring. Let's start by counting the teeth present. Quadrant 1. 1, 2, 3, 4, 5, 6 and 7. Move on to quadrant 2. 1, 2, 3, 4, 5, 6 and 7. Moving on to quadrant 3. 1, 2, 3, 4, 5, 6 and 7. Now finally quadrant 4. 1, 2, 3, 4, 5, 6 and 7. Note that all the 8s are unerupted. Now, we write our findings in the letter like this. We check for the incisor relationship, followed by the overjet and overbite. As for this patient, you can see that she has a class 1 incisor relation with an overjet of 2 mm. Therefore, we have to tick on this box. Now, let's check one by one if there are any other malocclusion for this patient. Does this patient have any supernumerary teeth? No. Gigi lambat tumbuh? No. Gigi deciduous yang tertinggal? No. Hypodontia? No. Tabiat? No. Gigitan silang anterior atau posterior? Yes. Therefore, we have to tick here. Here, we can see the patient has a crossbite at the tooth 2-2 and 3-3. So, the IOTN score would point to 2C. Next, gigi terimpak? No. Overjet more than 6 mm? No. Anterior open bite? No. Then, line. We can clearly see the patient has severe crowding on the upper and lower arch. So we write here displacement of contact point, which brings us to IOTN score of 4D. Next is radiographic investigation. If you have any radiographic evidence that you want to attach with the letter, you may tick on the boxes here. Finally, for the IOTN score, based on your clinical examination, we now have 2 IOTN scores, which is 2C and 4D, which leads us back to the Mokdo scoring. Since 4D is a higher score than 2C, our final IOTN score will be 4D. At the catatan, you may write the summary and other findings that are not explained yet. For example, Class 1 malocclusion on skeletal Class 1 with overjet of 2 mm and overbite of 20%. Class 3 canine relation on the right side, Class 1 canine relation on the left side, bilateral Class 1 molar relation, severe crowding on upper and lower arch. You may end the catatan with, "We hereby are referring this patient for further management. Thank you," with your chop and your sign.